Hey guys, this is Dr. Tim Heath with Optimized Wellness Center. Today I want to share with you some really interesting and important news about baby aspirin hosted by the Mayo Clinic. This is of great concern for many folks that have been told long that they should be using a baby aspirin on a daily basis. The reality is there are some other things to consider relevant to this. Cardiologists are often asked if I should take a baby aspirin on a daily basis. And often touted for its benefits for folks with heart disease, cancer, Alzheimer's, and dementia. Bayer sponsored a study, and this study was published in the New England Journal of Medicine, and it recently was reviewing about 20,000 individuals with a daily dose of a baby aspirin, and they found that there was no benefit. I want to repeat and stress that there was no benefit from continued aspirin use for otherwise healthy elderly persons who are usually the ones who are recommended to use a baby aspirin on a daily basis. And it resulted in higher rates of major hemorrhages or they died of cancer. So these findings were really quite troubling, and they were supported by major institutions like the National Institute on Aging, the National Cancer Institute, the National Institute for Health. All of these confirmed these findings that, in fact, the risk outweighed the benefit of using a baby aspirin on a daily basis. Specifically, this study was finding it for otherwise healthy elderly individuals. Some say a baby aspirin still is beneficial for those whom have suffered a heart attack or a stroke. There may be some evidence backing that, but that's not entirely the whole picture here. It's presumed to have benefits on two things in particular. And I'm going to go into a little bit of science here to explain this so that it makes a little more sense. One of the effects is they're on these two enzymes, and these are on two pathways in particular that the body uses. They're called the COX-1 and the COX-2 pathways. The COX-1 pathway, this is a pathway that's associated with like housekeeping. When I say housekeeping, aspirin is thought to inhibit platelets from clotting. But the risk associated with this is excess bleeding. So you've probably seen many older individuals who get a very minor cut on their hand or their face or their elbow or some other location, and they bleed excessively. They can't seem to stop bleeding. So this is one of the challenges. The other challenges are ulcerations in their stomach, which it then also leads to excess bleeding in their gut, which causes scar tissue and then inhibits absorption of the nutrients that they need in their body. Also, this COX-1 pathway has a risk of reducing kidney function and subsequently blood flow. Obviously, this is of major concern. The COX-2 pathway, this is associated with being a troubleshooter. And this responds to infections and inflammation. And it results in reduction of fever or reduction of pain pathways in the body. And because it can widen the arteries in fighting blood clots. But the risk associated with the COX-2 pathway inhibition associated with taking aspirin is that you can have a heart attack or stroke. Interestingly enough, given the fact that many people were told to take a baby aspirin specifically for heart benefits. This is seen specifically with some medications that many people are familiar with that have been removed from the market, Vioxx and Bextra. And then thirdly, with something called Celebrex, which is known to be where doctors have to take great control and consideration as it relates to making any recommendations for utilizing this medication for specifically this reason. The FDA, since 2005, has put what's called as a black box warning on all NSAIDs. These are non-steroid anti-inflammatory medications, and because of their cardiovascular risk, and this is with exception of aspirin. But it is important to recognize that there is a black box warning on all NSAIDs at this point, for this cardiovascular risk. In fact, the FDA reversed its position a few years ago, and this was prompted by Bayer's request for it to change its aspirin labeling to indicate that it helps prevent heart attacks in otherwise healthy individuals. And the FDA now states on its website that the FDA has concluded that the data does not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or cardiovascular problems. In such people, the benefit has not been established, but risk such as dangerous bleeding into the brain and stomach are still present. This is really important. That quote came directly from the FDA's website. In fact, Dr. Stephen Nissen, a cardiologist and chairman of the cardiovascular medicine at the Cleveland Clinic, says it is not a benign intervention. This is really important that many of these institutions and individuals that we would respect have come out with such strong comments. Also, cardiologist Dr. John Cleland from the University of Hull in the UK, he reviewed a series of meta-analyses. These are analyses that review many other analyses and research studies. So they put them all together into a meta-analysis, and he took many meta-analyses and he analyzed them and called the antithrombic trial list collaboration. This is what the research study he put together was called, and published it in the British Journal of Medicine, a very highly esteemed journal. And that after following 100,000 patients with high risk for cardiac events, it was concluded that aspirin therapy was not saving lives. Rather, it was changing how these vascular events presented themselves. So this is really interesting. It's not so much that it's saving lives, it's just they turn out in different ways. And notably, there was a non-fatal events may be reduced, but sudden deaths actually increased. And this was because aspirin may mask events that are already in progress. There are other risks in addition to taking a baby aspirin. It notably destroys your gut lining, and therefore you have an increased risk for ulcers, H. pylori infections, Crohn's disease, diverticulitis, inflammatory bowel disease, otherwise known as IBS, and intestinal perforations. These are all very terrible and very significant things, all associated with taking aspirin on a regular basis. So we need to be concerned about that. Approximately 36% of adult Americans are now taking a low-dose aspirin on a regular basis. Each year, conservatively, 15,000 individuals die and 100,000 individuals are being hospitalized due to aspirin and NSAIDs. These are staggering numbers that we need to be aware of. Aspirin depletes your body of a variety of very important nutrients, notably vitamin C, vitamin E, folic acid, iron, potassium, sodium, zinc, and melatonin. We can go into further discussions of each of those in our upcoming talks, but those are a pretty long and extensive and important list of nutrients that are depleted by utilizing aspirin on a regular basis. It's also associated with an increased risk for one type of breast cancer, an increased risk of kidney disease and failure, cataracts, macular degeneration and blindness, as well as hearing loss and tinnitus, that's the ringing in your ears, as well as erectile dysfunction. 22% increase found from Kaiser research study following 80,000 men found that there was this 22% increased risk in erectile dysfunction by using aspirin. But what can I do? So here we are, we're left with this question of not only do I know that now there are risks, there's been a recall, it is now known that we should be concerned about this. So what can we do? So 1 in 3 deaths in America are attributed to cardiovascular disease, but 25% are preventable. So the key here is to reduce inflammation. And this may seem simple and trite. So here are some actionable and specific tips around diet, lifestyle, exercise, sun, and earth exposure. So let's talk about these. So number 1, you want to know your risk. You want to know your risk for cardiovascular events. So you need to talk to your family doctor, your primary care doctor, your functional medicine practitioner about cardiovascular risk for yourself, and you need to talk to your family about the risks that's associated with them as well, and that may be attributed to you. You want to perform what's called as a cardiometabolic testing and review this with your functional medicine practitioner. This looks at a variety of very specific factors, and we want to be able to isolate those to know your risk. Secondly, you want to adapt a healthy heart diet that's optimized for you. There is no one diet, but that diet needs to be optimized for you in the specifics for you. This includes things like no GMO, eliminating gluten and other highly allergenic foods, swapping out trans fats for healthy fats like avocados, coconut, raw butters, and seeds. You want to have about half of your diet to include vegetables. You want to include fermented foods, limiting or reducing your sugars intake, increasing organic foods wherever possible. Go to your farmer's market, find local farmers, and start including those foods as much as possible. You want to balance your omega-3s, 6s, and 9s so that you have the right balance of those for your body. You need to also consider supplementation and getting lab testing to figure out where you are relevant to that. And you need to drink plenty of clean, pure water, lots of water to make that effective. So a couple other tips here that I want to make sure to introduce to you all. Thirdly is getting exercise and changing your eating schedule. So exercising as little as 15 minutes a day can add 3 years to your life. This is so important for people to recognize. Even if you have cardiovascular risk, it can add these 3 years to your life. If fasting insulin is above a 3, then you need to consider restricting grains and sugars. The Presidential Commission on Diet and Nutrition found that working with a skilled and licensed provider over the course of a year of approximately 12 visits or more can result in benefits, and these are permanent benefits for you. Number 4, improve your blood viscosity with grounding techniques. Viscosity means how slowly or quickly your blood is moving. So the higher the viscosity, the more it is it's like sludge, it's moving slowly. Grounding or earthing techniques. This is one of the best kept secrets. This is something everyone can do to prevent blood clots. And you merely need to walk barefoot on the soil, grass, sand, bricks. And this is where there's an electron exchange, and it creates an increase in antioxidant benefits. And this antioxidant benefit makes blood clots less likely due to decreasing the viscosity of the blood. This is because when grounding occurs, your red blood cells have more charge on the surface, forcing them to repel each other. And then the blood then flows more easily, and with this, your blood pressure drops. This is really a great benefit for people. And it takes about 80 minutes for this to occur, for these free electrons to reach your blood. Therefore, many people choose to come into our office, Optimized Wellness Center, and they prefer to use one of our cellular detoxifying ionic foot baths. And this uses the same premise, but it's more convenient, and this occurs in approximately 15 or 20 minutes while relaxing in our office. So there are 4 tips to help you out with dealing with these same, reducing your cardiovascular risk, and also you need to make sure to be able to eliminate the utilization of baby aspirin on a daily basis. Once again, guys, this is Dr. Tim Heath with Optimized Wellness Center. I'll catch up with you all soon again to talk more about how we can, other healthy tips for your lifestyle. Take care.